Good day and welcome to the Gates Foundation Optimist Conference Call with CEO Mark Suzman. Today's conference is being recorded. At this time, I'd like to turn the call over to Caitlin Sabacek. Please go ahead.
Hello, and thank you. Thank you all for joining us and for subscribing to and reading The Optimist. Today, we're really looking forward to answering your questions about the COVID-19 pandemic. We had more than 1,000 questions submitted for this call, so we won't be able to answer all of them, but we will keep sharing new information on The Optimist, so hope that you'll continue to read there. With that, I'd like to introduce our CEO of the Bill and Melinda Gates Foundation, Mark Suzman, who will be answering your questions today. Mark, to kick us off, I have a question of my own. What are you worried about, and what are you optimistic about?
Well, thank you. And first, thank you to everybody both for being a subscriber and for joining today. In some ways, it is tough to be an optimist in this current global situation. And even the kickoff question about what I'm most worried about shows that many of us are thinking about concerns. And I hopefully will come to some of what we think are the potential good news around the corner in some key areas like the research on vaccines and therapeutics. But what I'm really most concerned about at the moment is what the medium to long-term impact is going to be in developing countries, particularly in sort of South Asia and Sub-Saharan Africa, which have some of the weakest health systems and already have some of the greatest disease burdens with other challenges from HIV to TB to malaria to routine illnesses. And so currently, I think the developing countries and many developed countries have actually taken very tough and aggressive action, in many cases much stronger and swifter action than their northern rich country counterparts in terms of lockdowns and stopping the spread of the virus. And that's been very admirable and actually does seem to have been effective. But we know challenges around data and testing and the capacity means there are significant risks. And so we're working very hard with global partners like the World Health Organization, with regional partners like the African Centers for Disease Control, and with national governments like Pakistan, Bangladesh, India, Kenya, Ethiopia, to see what we can do to help address that.
Great. So this next question was submitted by Fernand Camino. What is the contribution of the foundation in this fight against coronavirus?
Well, we have multiple kinds of contributions. So in terms of our financial contribution, we've now committed an additional, this is in addition to our normal funding, $255 million in grant resources towards COVID-19 specific activities. Most of that is going to some degree to help with the search for efficient vaccines, treatments, which we call therapeutics. We set up together with the Wellcome Trust and supported by MasterCard Foundation, the Dell Foundation, the Chan Zuckerberg Initiative, and others, something called the Global Therapeutics Accelerator to try and come up with the fastest and most effective treatment possible. And then we've also been doing a lot of work, and increasingly linked to my last question, seeing how we can support developing countries in building their own testing and treatment capacity to help deal with the crisis. And so that's in terms of our direct funding. We're also allocating or planning to allocate several $100 million of our balance sheet that we can use for things like loan guarantees or bridge financing. So, for example, we're working right now on a potential opportunity with UNICEF and the World Health Organization to see whether we can help provide backstop resources to help procurement for developing countries in terms of getting essential supplies like PPE equipment, because currently many of those are being just purchased in bulk by rich countries, and we want to make sure we're thinking about equitable global access. And frankly, across everything we do, that's one of our central tenets, and it's actually written into the grant agreements we make. If you take our resources, you have to commit to making whatever products become available subject to what we call global access. That means they must be available equitably and cheaply across the planet for everyone. And so that's where our direct resources are going. And then increasingly, we also are using some of our indirect resources that are repurposed funding. So, for example, we are very major funders of the Global Polio Eradication Initiative. Very unfortunately, there's had to be a pause on some of the polio vaccination activities worldwide because it's contrary to the COVID social distancing, because giving a polio vaccine requires coming in contact directly with a child and the parent holding the child. But that means there are lots of resources, health resources, particularly in Africa, which we and other partners have been funding, like emergency operations centers, surveillance tools to track the disease, which can now be repurposed to COVID support. So we're doing both that kind of direct support and then the indirect support that I'm talking about.
Our next question comes from Caroline Lombardo. What ways do you see for ensuring that immediate COVID-19 response measures supported and initiated by philanthropic actors are supportive and not undermining of long-term capacity building of countries and communities to manage and reduce risks to inclusive and sustainable development?
Well, that's a great question, and it's not something that's unique to how we think about the COVID crisis. This is fundamental to how we operate as the Gates Foundation everywhere we work. We always want to be sure that we are using our philanthropic capital, which is the resources we have, to its highest and best use. That means we should never be either displacing or substituting when either public governmental capital or private capital might better be used. We're trying to come in to fill what we call market failures or gaps, where something like the rapid bridge financing I was talking about, where funding will come on stream for procurement, but they can't move as quickly as we can. So the very first COVID-related grants we made was back in the last week of January, was a set of grants to support the African Centers for Disease Control and Prevention, because at that time we could already see that the disease was ravaging China and there were severe risks in Africa, and at that time only 2 African countries even had the capacity to test. So our early resources coming in there helped the African CDC work with dozens of African countries to help equip them to be able to have the testing in place, which they now do, and which has really helped the crisis. So we're able to move, philanthropy is able to move quickly. We can take some bigger risks. So, as we're looking at some of the funding around the vaccines and the therapeutics, we can move in and fill some gaps quickly or accelerate things. But in the end, the big resources are going to come from governments. And last but not least, we're always trying to think through, can we put in place sort of systems and structures, or when we're working this, that are actually going to have benefits long after the COVID crisis is hopefully history. So an example would be, as you're preparing in developing countries, one of the critical needs is to have effective oxygen supply, because we know breathing and respiratory difficulties are one of the core symptoms. Now, oxygen supply is a perennial challenge in many developing countries anyway, and it's needed often when there's complications around childbirth or many other related activities. And so if we can fix this now for COVID, that will actually have very strong long-term benefits for the health systems and structures in those countries. And that's, again, where our philanthropic funding can come in and hopefully build some structure that actually builds long-term capacity with our partners. So we never want to be substituting for them. We really want to be working closely with them and ideally helping put in place technical resources and strong capacity to carry on the work afterwards.
Thanks, Mark. So here's a question from Katie Gilbert. What role, if any, will the Gates Foundation take in countering emerging misinformation related to COVID-19 that could impede behavior change or future acceptability of a vaccine?
Well, that's a question that's very much on my mind at the moment and all of our leadership's mind, because misinformation is always a challenge around health scares. It's just when people panic and are nervous, it's very fertile ground for conspiracy theories and worries about the safety and efficacy of vaccines or other treatments or projects or just anything like that. It's just when people are frightened, they're more likely to be prey to misinformation. And obviously, in today's social media context, it's much easier for that information to be spread very rapidly. So we pride ourselves on being a very transparent and fact-based organization. We're very open about everything we do. We fund a number of initiatives that try to put out clear factual information based on the best available science. Unfortunately, the reality is even we ourselves are finding out that we've become more of a target of misinformation as our own role in the COVID response has grown. And so we're both trying to think through how do we work with strong third-party validators, because you do want to do, whether it's national institutions in the U.S., like the National Institutes of Health or the Centers for Disease Control, or global institutions like the World Health Organization, and independent bodies that we often help fund, like the Institute for Health Metrics and Evaluation, which puts out data. Is just how do we just try and put out the clearest, most reliable factual data about the virus itself, about the best tools and steps to address it, and then in terms of trying to keep our own credibility and validity as a voice, just being as transparent as possible. Again, as the Gates Foundation, one of, if you like, the luxuries we have is that Bill and Melinda Gates and Warren Buffett have given us by entrusting the resources they have, is our mission is just simply to ensure that every person on the planet can have the opportunity to lead a healthy and productive life. And we are always trying to put out sort of resources, ideas, information, whether it's related to agricultural productivity, whether it's related to financial services, whether it's related to sanitation, whether it's related to education in the U.S., and now in the COVID context, obviously related to both the best tools and policies available for governments based on the best available current science and data, and hopefully the tools down the line in terms of the therapeutics and vaccines we need. But it's very complex and challenging right now.
Thanks, Mark. Our next question comes from Pauline Arungu, and she asks, how is the foundation supporting health system strengthening in African countries beyond working in specific areas, since COVID-19 has really demonstrated that strong health systems are critical to a successful response during this emergency period and beyond?
Yes, well, I gave a partial answer to that already using the example of, say, oxygen supply, and working on health system strengthening, not just in Africa, but across the developing world where there are often weak or challenged health systems. We do it in South Asia and other parts of the world as well. And that's actually a central part of our regular work. We do it together with partners like the Global Fund to Fight HIV, TB, and Malaria, or the Gavi Vaccine Alliance, because all of our regular work around, whether it's provision of antiretrovirals and looking after HIV-positive patients in Africa, or TB patients, or whether it's about getting regular, ordinary vaccine supplies across the continent, you need strong, functional, particularly primary healthcare systems. And so that's a central part of our regular work. And in the context of the COVID response, we've now really been trying to accelerate, say, what are the specific additional resources that are going to be needed to help strengthen those health systems. So that includes working with the World Health Organization, AFRO, which is their African regional body that oversees their work across the continent, and then working specifically with key national authorities and regional authorities where appropriate. So, but it's a very critical element of everything we're trying to do.
So our next question is around gender, and Shireen Motara asks, how has your COVID-19 response considered women and girls?
Yeah, another great question. So there are a couple of answers to that. One is obviously when you look at the how the disease actually operates. For reasons we don't fully understand, it does seem to have higher mortality rates among men rather than women at the moment. But there are particular cohorts we don't have enough data on, like what is the effect on pregnant women, for example, or are there differential effects for different age cohorts disaggregated by gender? And so one level, you're trying to just make sure that research is underway. A second is when we do the work around trying to develop new vaccines and treatments, you make sure that all the testing for those vaccines and treatments actually is disaggregated by gender as well, because often there are different response activities among women rather than men. And so on the science side and the response to the energy, that's one element. But then there's a secondary element in terms of the social and economic impact. So we know that I was just talking about primary healthcare systems, that frontline healthcare workers in most parts of the world, rich and poor countries alike, are disproportionately women. And so given we know that frontline healthcare workers, nurses and others are often most at risk, need to be prioritized for personal protective equipment and related activities, need to be prioritized for testing. And ultimately, when we have treatments and vaccines, will need to be prioritized there. And so, there's obviously a strong gender element. And then last but not least are some of the indirect socioeconomic impacts. So the data is poor and anecdotal at the moment, but there is some evidence that one result of the lockdowns, and again this is based on anecdotal data and some slightly more robust data from China, from the United States, from France, from other parts of the world, of increases in reports of gender-based violence, and there's some logic to that when you see if the people are already in challenging relationships and you're locked down in the same household, you could see why that might be an environment that makes that more challenging. And so trying to think and work through are there sort of aspects there where we can provide informational resources that help governments or health systems deal with those elements. So, multiple strands, but a very important set of questions that we are focused on.
Great. So this next question deals with our education work in the U.S., and it comes from Lynn Weisenbach. Given that the Foundation has made commitments to education ranging from early learning through post-secondary, A, what implications do you see moving forward? And B, what can educators from K-12 to university faculty and staff, as well as parents and students do to pivot and leverage this new reality?
So we do have a modest global education program, but education is far and away the largest component of our work in the United States. And as the question notes, we work across early learning, we work comprehensively across the K through 12 system, we work on post-secondary education, and our primary goal across all of those is to really help low-income students, students of color who often have lower achievement and other rates and face particularly challenging circumstances in terms of trying to close that gap, provide opportunities, make sure that graduation rates go up, make sure that those kids do get access to sort of quality education in college and from there into the job market. And we had been having actually, I just saw this week, some encouraging data when you look back across the last 5 years in terms of some of the trends and increases in college graduation rates among those kind of cohorts and their access to the labor force. And obviously that has got amazingly disrupted very quickly over the last just 6 weeks. So first, as unemployment rockets up, even a college degree does not necessarily get you into the job market. Second, as huge numbers of students, all students really, in both K-12 and post-secondary have now been sent home, it completely exacerbates the gap because poorer kids often do not have access to computers, they do not have access to Wi-Fi services, they're less likely to have parents or others who are able to help engage them with content. And so we already are seeing significant gaps opening up in terms of just the ability for low income students and I think to keep up. And so in that, we try to pivot our work where we're pooling resources with some other funders and repurposing some funds to say, what are the best ways to help accelerate that shift to online education in smart ways? Because at the moment there's a profusion of resources and they're not very well curated. So can we have clearer standards and systems and structures to help that? Are there specific steps that can be put in place to help bolster sort of school districts and others who are really struggling to find the capacity to shift into that online learning? Are there ways we can work with groups of universities or others in terms of their online offerings to help, increase the quality of the content and ensure that there is access even to the poorer students who don't have the same resources? So there's a huge amount of work underway, and as I say, we're very concerned that in the short term, there's going to be significant damage, but there is a real opportunity that this could be a dramatic acceleration actually into over the next 2, 3, 4 years, providing a much more equal footing for those students. Because if we can move successfully to quality, accessible, online, digital learning opportunities, that should actually be a tool that enables poor and lower income families to engage much more systematically and hopefully close some of those achievement gaps. But it's obviously the biggest disruption to the education system that we've seen in recent memory and possibly ever. And now many of those same challenges are being felt around the world. And so a lot of the lessons that we're learning here in the United States, we hope will be real public goods in terms of how to deal with distance learning and remote learning. But it's a very, very disruptive set of challenges.
Thanks, Mark. The next question comes from Kimberly Quanstrom-Gilson, and she asked, how is the COVID-19 pandemic changing or shaping the Gates Foundation's perspective and decisions around funding ongoing health priorities such as malaria, family planning, and MNCH, as these issues don't just disappear in the global south, but continue during the global pandemic and may even become worse as attention has shifted to preparing and responding to the pandemic? Will the Gates Foundation continue to fund these areas?
So the short answer is absolutely yes. As the question very rightly says, none of these issues go away. The fact that COVID has suddenly appeared doesn't mean there's suddenly less risk of mortality at high-risk childbirth context. There's no decrease in regular diarrheal diseases. There's no decrease in HIV, TB, or malaria. There's no decrease in neglected tropical diseases. Smallholder farmers suddenly haven't become miraculously more productive. In fact, there's more pressure being put on systems because often there are flights from urban to rural areas that put real pressure on food systems. So we are committed to continuing all our work on our existing priorities, but we cannot do it in exactly the same way. As with my example of the polio campaign, in fact, there's disruptions to all vaccination campaigns at the moment. These can be very damaging. I mean, it's not an exact analogy at all because of the different nature of the virus, but it is true that during the Ebola crisis in West Africa a few years ago, that ultimately the higher mortality from greater child and maternal mortality because people couldn't access health systems, weren't able to get vaccinated, had more car accidents, actually far exceeded the mortality from the Ebola virus itself. We need to be very careful to make sure that's not the same with the COVID crisis, even as we're taking these responsible steps because it is a novel pathogen and so dangerous. It's critical that we keep basic services going, and in all the ones that we've chosen to prioritize, and you've cited a number of them, family planning, maternal child health care, diarrheal diseases, HIV, TB, malaria, but also some of those other related ones like access to sanitation, or for access to financial services, we are trying to go as responsibly as we can and as capably as we can to keep pushing forward in all those areas, even while we're doing the COVID response. And when and where there is important and potential overlap, as we've talked about with the support to primary healthcare systems or areas of work like that, then we're trying to sync up those lines of work. But it's very much a both and because those priorities remain ones that are deep burdens for the poor around the world, and we need to ensure that we're continuing to stay focused on that as well.
Thanks, Mark. This last question was submitted by Grishma Biswal, and they asked, pandemics like this are sudden and devastating. Even after facing similar situations in the past few years, we are still not prepared for such situations, despite having advanced in science and technology. Where are we lacking, and what preventative steps should be taken to overcome such life-threatening events in the future?
Yes, so this obviously is something we have worked and thought about a lot, and it's widely known that we and Bill and Melinda Gates have been calling for the last few years, warning that the global pandemic was probably the greatest risk to humanity and that we should have stronger preventive actions taking place. Clearly, that did not happen at the scale and scope that was needed. There are some bits of good news. So, for example, we did 3 years ago set up, and this was the Gates Foundation with the Wellcome Trust, which is a big UK-based medical charity, and several governments did set up the Coalition for Epidemic Preparedness Innovations, CEPI. And right now, CEPI is at the forefront of the fight or the race to get to an effective vaccine, because we were looking and we knew we needed something to prepare for vaccines against likely pathogens. And so we're very, very pleased we did do that funding. It hopefully will be a tool that leads to essentially what's going to be the fastest ever creation of an efficacious vaccine that goes through trials and can be put out to the wider planet. And that effort needs to be even more fully resourced, and there's been encouraging recent steps by governments like the United Kingdom, Germany, Japan, and others, Norway, putting more resources into that. But, that's one small example that we really needed to have something in place that was both thinking of the testing challenges. No country has yet fully tackled the scope and scale of testing that's needed in order to manage until a vaccine comes along. What are the equivalents that you have in what we call therapeutics? I mentioned this Global Therapeutics Accelerator that we're doing. We should have all of that sort of ready and in place and ready to go. There's both monitoring, so surveillance systems that are tracking potential emerging pathogens, so you identify them as early as possible and start the race to do it. And you need a much stronger, linked up global set of both actors and systems that cooperate across borders. Because if there's one critical lesson, even as many countries focus on their national responses, is diseases do know no boundaries. They affect the rich as much as the poor. They will affect rich countries as much as poor countries. Until we tackle and solve this problem of COVID globally, no one locally, no national or local effort is going to be fully safe and secure. And so what we need for the future is a very robust set of networks linked across both national expertise and multilateral expertise that's thinking about both the science and the tools that we're going to need, but also the health systems, the structures, the contingency stockpiles. So I think it's very unfortunate that it took a crisis like this for us to learn the lesson. I think and believe that lesson likely has now been learned. And when we're through the crisis, I am genuinely optimistic that we will be able to build a much more robust structure so that we never face something of this magnitude again without being able to respond much more quickly, much more effectively on a global and joined up basis. But there's no question between now, where we are still in the midst of the crisis and we don't yet have those tools, and getting to that end state, it's going to be a challenging road ahead.
Thanks, Mark. We're almost at time, but I'm just wondering if there's anything else about this pandemic or the Foundation's response that you want to convey to our listeners before we sign off.
Yeah, I think maybe just the wider point that I was just making about this being sort of global and multilateral. I know there've been lots of discussion recently, and we even have spoken in terms of, what is the role of the World Health Organization or other global things, and, what have they done well or badly? And it's true, no institution performs perfectly, no national government, no multilateral agency, and, there are always going to be challenges. But what we need for this next phase, and particularly as we're thinking about sort of treatments, and is we need to think across all of these areas. We need to think across the diagnostic space, because until we get an effective set of widely used rapid diagnostic tests that can be operated cheaply around the world, we're not going to be able to have a quote-unquote return even to semi-normal, because you need to be able to identify and then trace people who are ill. Until we have a set of successful therapeutics and treatments that maybe can act as prophylactics and then sort of treatments that also makes it much more challenging. And obviously, until we have the vaccine, there is no real back to normal. And that requires these global entities like the World Health Organization, like the Gavi Vaccine Alliance, like the Global Fund to Fight HIV, TB, and Malaria, institutions like the Bill and Melinda Gates Foundation, like the Wellcome Trust, working with key national governments. And, this includes the United States, the European governments, Japan, China, and obviously the key southern leadership governments like the African governments and so on. This needs the true multilateral response if we're going to be able to tackle this. That philanthropies like ours can provide innovation, we can provide data, we can provide specific support and catalytic support in the way I've described, but actually tackling this crisis and making it a sort of sustainable, equitable set of solutions that ensure that the poorest have the same access to the treatments and vaccines that the richest do is going to require a pretty unprecedented global response. And hopefully we'll see that happening in the weeks and months to come. But it's something we're working very hard to see where we can be most helpful.
Great. Thank you, Mark, so much for your time. And thank you to all of you who dialed in and submitted questions. We're going to end the call here, but please stay tuned to The Optimist for more updates, and we'll be in touch soon.
Thank you all very much.